Welcome to Duke University's HeatWise Policy Partnership Summit. This briefing will focus on data for risk, exposure, and impact. I'm Ashley Ward, Director of the Nicholas Institute's Heat Policy Innovation Hub at Duke University, and I'll be moderating our panel of experts. It seems that everyone I talk to has a data issue. If you're a person in local government and leadership, you need data to better understand who is vulnerable in your community, how best to develop interventions to reduce the impact of extreme heat, what are the proper mitigation techniques. If you're a state or federal government official, you're looking for data to better understand how and where to allocate resources, and perhaps which policies might support local adaptation and resilience to heat. If you're a leader in industry, you might be looking for data to help you better understand how heat impacts your operations or the people that work for you or the people that you serve. And if you're in finance and insurance, you might be trying to figure out how you can better understand how heat might increase the risk of investment. Regardless, in each case, data often is a barrier to improved understanding and impactful decision-making, particularly around extreme heat. And so to set the stage for this conversation, we kind of have two sets of panels. This first panelist, really represent local and federal organizations and agencies who work directly by those impacted by heat. We have Jane Gilbert, who is the Chief Heat Officer for Miami-Dade County. I want to mention the first heat officer in the nation and the first woman to hold this position. Nick Shufro, Deputy Assistant Administrator at FEMA, who is responsible for risk management. Jeff Glaser, Jason Glaser, founder and CEO of Isla Network, committed to improving worker safety around heat. So welcome all of you. Thank you so much. Jane, I'm going to start with you. You're sort of forging new territory. What specific data challenges have you faced in understanding and addressing heat vulnerability?
Is this working? Yeah. Okay. So first, I just want to acknowledge I wouldn't be in this role if it wasn't for the vision of our mayor, Danielle Levine-Cava, for appointing me. But I was hired to look at the increasing health risks and economic burdens associated with extreme heat. And so the first thing we really needed to do was better understand the problem and who and where people were most at risk. So we looked at heat-related emergency department visits and hospitalizations by zip code in the county, and then looked at what were the top correlating factors associated with that. And low income, high land surface temperatures, in other words, our urban heat islands, and high percentage of outdoor workers were our top correlating factors. And those, that vulnerability assessment really helped us inform our interventions. But that's the tip of the iceberg of impacts, right? That's just heat exhaustion and heat stroke. It's not the heart attack that was created. It's not the pediatric asthma trigger. It's not the preterm births. We knew that there were far more than that. So we also did excess mortality studies. And we looked at the 5 years pre-COVID and hired a researcher who ran the numbers two different ways. One was individual heat days, and the other was using a lag effect on the model. And the first study came up with an average of 34 deaths a year, and the second one, 600 deaths a year. So I said, which one do I use? And he said, well, somewhere in between 30 and 600. So how do you manage a problem when you don't really know what your problem is? And mortality itself is just the tip of the iceberg of, there's learning outcomes, there's all sorts of things. And what we also did understand from that study, because we also, with the excess mortality, looked at what were the temperature thresholds. And what we found in Miami, which is true of the Southeast in general, is we have more chronic high heat rather than episodic. It's not the heat waves so much as from May 1st to October 31st, we can have dangerous high heat any day. So we are getting better data on certain things, but there's so much more that for us to understand just in how we know outdoor workers in homes and then urban heat islands. Those are the three areas we need to do deeper dive of really understanding the impacts. How many of those preterm births that were influenced by heat happened because of exposure in the home or in the workplace? So that we can design interventions that make sense. And the urban heat island, how can I work with planning to create zoning that incentivizes urban heat island mitigation without legally defensible data that shows that different interventions, whether green infrastructure, cool building materials, cool pavements, et cetera, if I can get legally defensible data on that, then it's going to be a lot easier to pass zoning codes. So there's data around urban heat island, there's health-related data that's a result of, they're not coded for, so many things are not coded for having been heat exposure. And then there's in outdoor workers, and Jason can speak more about that, but we're really, as even just a county with 38,000 employees and very different job types, really struggling to get the right set of protocols to both certainly protect health, but also optimize productivity within that. And we need a lot better understanding on that.
I think that was actually the perfect tee for Jason here. Isla's network's focus is on improving worker safety from heat. And I know you've been working specifically at this intersection, right, of protecting health, but also the labor productivity question. So I just want to, what have been the biggest challenges here? What are the barriers for people getting the data they need? And you all have done some pretty interesting studies around this.
Is this on? Yeah, it's on. Hi. Well, I want to applaud Jane. I mean, like every bit of praise she gets and applaud, we should give it your way and to the mayor, because every city should be doing what you're doing. And yes, I know it's really frustrating when an epidemiologist comes to you with a bunch of multivariate regression models and says, "Oh, pick one." But it's amazing that you guys are making those investments and trying to figure out what the heck is going on. So with La Isla Network, we really cut our teeth abroad. So we still work in Mesoamerica, South Asia, and in Europe on the intersection of heat stress and occupational health. And we work in some of the toughest environments, so your sugarcane cutter, your foundry worker, your bricklayer, your salt pan worker in Pondicherry and India. And so these have provided us a real insight of what is to come for us and what is in Miami already there, or in Austin, Texas, or Chicago in the summer. And it's given us a huge amount of insight into what is required to reduce harm. So if I break it into kind of three sections, and on harm, the big outcome we look at is hospitalized heat stroke, acute kidney injury, other illnesses and injuries that are copied by health and safety teams at the sugar mill, and we've reduced those by 80 to 94%. So that's pretty big, but it didn't happen overnight, and you have to invest a lot in organizational assessment. I wish we would have started with our org psych team before our epidemiology team, honestly, to figure out what the prioritization levels are from the C-suite to the workforce. So really focus groups and qualitative data need to be focused on, so then you know what quantitative questions to ask on data acquisition. The second thing, I think we have the only study of the very specific impact heat has on productivity. Now, these are sugarcane cutters, it's quite specific, even more, but it's about every degree of wet bulb globe temperature over 26, you lose 3 to 5%. It's hyper-specific, but it's really interesting and informative. If you don't come up with an intervention, you'll have worse outcomes. What we showed with the intervention is a 10 to 20% increase. And then we also did an ROI, and we used a very boring RAND model. So if we're talking about models, because we didn't want people really arguing over it, so we used the RAND Corporation's model for the return on investment, and it was 22%. And it's important to note that the medical data and outcomes are ours. So they can't be tortured by the companies we work with. But the productivity and the ROI data, we build a good enough relationship. We get all their HR data, all their finance data. It's their business decision data. And that gives us their insight. But we've reduced harm, we've increased productivity, and we've provided an ROI. So the question for the US becomes two things. And the data hole that we have here is, why aren't we doing similar things like we are abroad with US funding, where we set up centers of excellence in at-risk industries or cities that are already doing great work and fund Jane to go, how do I develop an intervention for waste management, for parks and rec, et cetera, and then build off those to have peer-to-peer learning, which is exactly what we're ironically doing abroad in Mesoamerica, but not at home. So for me, the big data hole is at home, but we have models that we are already developed abroad that we really need to bring back and are already funded by the Fed.
Yeah, so I think, certainly that's very interesting. One of the things I've heard you say before is, how much funding and effort, resources have gone into studying this question, in the Global South. And perhaps this is a moment where we can, facilitate Global South to Global North learning on this topic, but it also needs some investment in the U.S. And I think, Nick, I'm going to turn it over to you now, which, I kind of see two issues, I think. One is that, FEMA has its own data gaps that it's looking for. And so, hearing from you about what that looks like, but also thinking about how we can facilitate, data is not necessarily an exciting investment for people to make. It's hard to make the case sometimes that we need to invest in this kind of, data collection or something to get people to invest in that way. So I don't know if FEMA's thinking about this or not, but I'd love to hear from you what your thoughts are.
Well, thanks for having us, and delighted to be here. So FEMA is, and obviously last week's petition is interesting to a lot of people in the room, and I will say limited amounts on that because there's really not much that I can say at this point. But one of the things in terms of data is that we rely very closely on our partners. So Julie Turtown, who from NOAA, our friends from HHS, we will rely on the interagency. And if you think about it, there are certain aspects of heat which are really not necessarily in FEMA's standard portfolio. So the science of understanding whether or not there is an issue, whether there's a named event or not, or there's, what's actually happening, that's really NOAA's purview, and so we work together. On the health aspects, HHS is very involved, CDC, and there's a very active interagency working group on extreme heat, and so we rely on a lot of data from those organizations that are they're also affiliated with the National Integrated Heat Health Information Systems, or NIHIS, that NOAA and CDC started in 2015. So part of this is we're in this space, but we don't need to make all the data. And so if we can leverage other partners' data, that's a really good way for us to move forward. And there are a number of precedents. LIDAR, which has come up, there's an interagency working group on LIDAR. And so we are the largest contributor to LIDAR. So I think at 1 year in 2018, I think we contributed something like $178 million to mapping the country. But what we do, and I lead a group called RAPID, which is the Risk Analysis Planning and Information Directorate. And our largest component is around flood risk. So we run the Risk Map program, and we look at risk across the nation from flood. And some of the challenges that we have right now is that a lot of our data collection is around prior examples. So, what are prior conditions? We look at development, and we're sitting there and we're starting to look at future conditions. So a lot of our data is static. It's based on a snapshot at a point in time. We revise that data every 5 years by statute. We're supposed to look at flood risk data. But having said that, looking at future conditions is something that we need to consider. Our data does take into consideration, when we leverage information from other agencies, human health impacts, but we don't really look at that. We have some tools. So who here has heard of the National Risk Index? Okay. And who's heard of the Resilience Analysis Planning Tool, or RAPT? Okay, so these are tools that we have that are out in the public domain. NRI, or the National Risk Index, looks at 18 different hazards, including health, including heat. And with those data points, you can either look at risk to a community across all 18 hazards, or you can disaggregate it and look at health, heat. I don't know why I keep on saying health. They are tied. But we're looking at more holistic data, and I think some of the challenges that we have are looking for actionable data that we can translate into specific actions. We look to coordinate data coordination. We're looking, at methodologies for capturing death and injury, and a lot of times when you're sitting there looking at, is it 34 or 600 fatalities, part of the challenge is that often by the time a body gets looked at, they're cooled down and it's not listed as a particular cause.
We all die of cardiac arrest or respiratory failure.
Exactly. So we're working on, we're looking through analogy, we're looking at trying to get additional data, future conditions, we're trying to get the health impacts, we're trying to make sure that we're not recreating the wheel. And there are opportunities for us to move forward, and we are aggressively looking at heat. So I'll leave it at that.
I think so. A question just popped up in the chat, which I actually, kind of is where I was about to head with this, which is one of the challenges with Jane and Jason have both pointed out is, in many cases, we're asking for health data so that we can, make the connections that we need to determine which thresholds of action to better understand what the true impact it. And that data is often very complicated and difficult to get for obvious reasons. But the question is, how do we make data not the next gold or oil in this space, meaning making sure that it's broadly available and accessible? And so in my own work, there's always this tension, right? Because you've got health data and the need to protect the data about individuals, right? But also the need to help emergency managers, public health, everybody that's serving communities understand, who's vulnerable, how they're vulnerable, when to act, and all of these things. So, how can we bridge this? Have you seen any models where this has been something, a lot of what I see is aggregated up to the county level or state or higher, which makes it actually hard to use for local decision making. So, have you seen a bridge here?
I don't know if I've seen a bridge, but I do want to compliment the federal government for how they have moved forward with more heat health information broadly and made it more accessible. It's been very helpful to get the heat risk tool, to get the resilience index that or what was it, the national risk index, all of those are helpful, but they aren't a high enough resolution often for local communities. And I know communities in other states have strong relationships with their state health departments, for instance, and have had a stronger ability to do that than we've tried to get a surveillance dashboard, but that has not come forward. So what we're doing now is working with our own emergency 911 calls and those of the city of Miami to have those reports come out during our heat season so we can better understand at least, and that there's 34 municipalities in Miami-Dade County, so that those two don't cover it all, but it covers the vast majority of the population. So it gives us a good indication. But we need the bridge somehow between local, state, and federal, or just straight federal. I think that our university partners are also been helpful at times. Some are health systems unto themselves, and our public health hospital as well. So those are areas where we can, in pockets, get better, higher resolution data. But it takes time. Even for me to get data from my own within county departments, from my own fire rescue was challenging, and our the disaggregated data with LIHEAP, that was challenging.
Yeah, no, I appreciate that. And actually, I do agree with you. I think this is one of those questions where I think universities have a strong role to play here. There are many health researchers at universities that, and I know even with us, that have access to even data that's hard for state partners to get. I mean, some of that data is proprietary data that's purchased with and comes with data use agreements. And so this is perhaps an opportunity, right, for partnership with universities who maybe have finer grain health data. But even when you have that data, Jason, one of the things that I'm curious about your organization, how you're thinking, you've done a really great job of like collecting data and then connecting it with health outcomes and then thinking about, sort of the economic impact of those. Are you incorporating future climate scenarios so that you can say, here's what it is right now, but like this is the 10-year, 15-year, this is what you're looking at.
No, I mean, that's really exactly where we're heading, because like we kind of wanted to get it right for what was immediate with the populations we're working on. And as we bring things back home, I don't want to sound hopeless about back home. Ideally, Jane and I will be working together. We've been talking about how and what it would look like, but we want to support like the good work she's doing and also the good work that a lot of people are trying to do stateside. And I think universities do play a huge role, and part of that is working with our climate modeler team to figure out what's coming. And so stateside, how to build a bridge, I really think like if we're able to fund internationally centers of excellence in at-risk populations and groups and industries, why don't we do that here? And like, why wouldn't we work with Miami, because you already have great leadership there, to start doing it? And then, what we're doing in Kansas City with Turner Construction and then Chubb, Liberty Mutual, and Zurich, the agreement we have, as you pointed to, the agreement's really important. What we publish is public. So it is data to be used by everybody, and we're looking at the current risks for their construction workers on a big data center, a multi-year project. And then we're looking at, do they need improved interventions? And if we, then the next year, once we improve the interventions, how are the outcomes? But then the big one is, what's it gonna look 5, 10, 15 years from now? And that's all part of that project. But what we need to do, and I think all the researchers need to do, is make sure that your paper isn't your alpha and the omega, right? Impact beyond the impact factor. I'll beat that drum till I die. And it's like, how do you make sure that Jane gets the data she needs? How can I get a pipeline to FEMA? And like, how do I set up the relationship with FEMA or OSHA to say, here's relevant data to help you make your decisions, and when you're in policy discussions, inform those parties. So I do think the Center of Excellence model is really good, but only at scale, and only if there's a very clear pipeline. To the insurers, frankly, they need to know, to the employer, to the workforce, but obviously to the feds and the local governments. And unless that's considered at the outset, because of data privacy, et cetera, you're in trouble.
So, we think about data going forward, right? I mean, how to project this into the future with climate scenarios. But Nick, one thing that I think about a lot too is even when we use historic data, there are biases already in that data, right? So weather stations are not in every county, I mean, the truth is that would be an enormous expense on our National Weather Service, on any other federal agency, and so usually they supplement that with state. But there's an intense fragmentation of this data from federal to state to local to citizen science to NGOs. And I'm curious what your thoughts are on the role that the federal government can play and maybe trying to help solve that fragmentation problem. It's hard for me to imagine that would be a problem that could be solved state by state. It would be even itself fragmented. So it feels right to me that that's a federal purview. And I know that wouldn't necessarily be FEMA's purview, but from your perspective in working across different federal agencies, what does something like that look like? How can we reduce that level of fragmentation in the data sources that we have?
So once again, I'm responsible for the flood risk mapping program. And there are no comments about flood risk maps. They're absolutely perfect, no criticism ever, right? And it's an evolving field. I mean, so you think about it, our program was built many years ago. 68 was when we started, and we got pictures, and I'm using the analogy of flood risk because this is what will happen with heat risk. we looked at big zones, and then we got much more granular, and about 2.5 years ago, we released information going down to the structure level, looking at flood risk at the structure level. So there had always been, and there's going to be biases, there's going to be incorrect data, there's going to be other problems. But having said that, the information is not as actionable and useful to the average American because, and the story I like to tell is that my wife and I bought our first house 30 years ago. And I'm from New York City, so the idea of, owning a house totally beyond my imagination. Buying insurance, I never knew that, flood insurance was not part of regular insurance. And we were clueless. We bought, and we were very lucky, we bought a house that has no risk or very little risk. Fast forward, and it never would have occurred to us 30 years ago in those days to write to FEMA and ask for a flood risk map and say, can you send it to us because we're considering buying this house, and we were looking at a dozen houses, so we'd have to, ask for a dozen maps to be sent by FEMA and then look at them and try and understand them, totally beyond what we could have done. And fast forward, one of the things that I'm really proud of is that over the last couple of years, we've taken our data, and our data is not perfect. And we know that there is room for improvement. But having said that, we got Zillow to pick up flood risk. And so now when you look in Zillow, and I've had colleagues who said, I want to buy a house, and I looked and it said, oh, there's a flood risk is pretty high. And it's not necessarily actionable. People don't really know the scale. But having said that, if it deters somebody from buying a house because there's a potential for flood and they don't want to deal with all the aggravations of that, then we've achieved our mission. And all of the other providers like Redfin have all followed Zillow's lead. So when you go in, it's not necessarily the front page, but it's there. And so if anybody's bought a house recently, you can look at schools, you can look at community walkability, there is flood risk. And I would like us to go mainstream in retail. And so the idea of the federal government having extensive tools around heat risk or having information that looks at the vulnerabilities, that's great, but people don't go. It's like the old Dr. Dolittle. There was a push me, pull you. Remember that from Dr. Dolittle? It was a two-headed llama. And so do you get information pushed out to you, or do you just take it in? I'm a receiver. I'm that side of the push me, pull you. You have to send me an email for me to respond. And so when Jane's looking at data, we've got to make sure that it's available to her her constituency, and it's understandable and actionable.
That's really great. And actually, that is a great segue. We're going to do a quick switch of panels because we have now the public sector, the private sector folks coming up. But I think your example there with Zillow is an example of how, these kinds of issues that developed in the public sector, right, can be useful to the private sector. And we're going to now talk about sort of the reverse, what can the private sector do to support some of these challenges in the public sector. So I want to thank all of you for this very brief panel. I really appreciate it. This is a huge topic. Honestly, we could have done an entire conference just on the data question. And I hope that in your roundtables, you'll get a chance to really dive deep into some of these things that you all have raised. But I want to thank you for giving me a few minutes of your time. So we're going to do just a quick switch and bring the next set of panelists up. I'll figure it out. Okay, so we have, starting to my right, we have Francis Bouchard here, Managing Director for Climate for Marsh McLennan. Stephen Lukovsky, I had to see who was beside me, Architect and Software Engineer for Amazon Web Services, and Evan Kodra, Senior Director for Climate and ESG at ICE Data Services. And so I want to kind of really pick up right where we kind of left off with that last conversation. And Francis, I'm going to start with you on this. And I know that you've been thinking a lot and working a lot on how to empower local and community decision makers. And I want you to say a little bit more about the potential role of the insurance sector can play in fostering these more robust data-driven decision-making, at the state and local level.
Yeah, it's a great question, and the insurance industry essentially is a data-based decision-making sector, right? And when you look at the role the insurance sector typically plays in risk, It's varied, but essentially we are the canary in the coal mine. You've heard that a lot. And that role as it relates to climate, so this will be broader than heat for a wee bit, but it's really being challenged today. And it's for a variety of reasons. A few of them are structural. For example, we price risk in 12-month increments. And I doubt Mother Nature thinks in 12-month increments, right? She thinks in a much longer temporal time frame. So our focus on kind of the longer term, what's happening out there, is really concentrated in that 12-month period. So we have a mismatch between the development of the risk and the peril and the way we're pricing it. So that's one I don't want to say flaw in the system, but one mismatch in the system that's really challenging the insurance sector to be able to play its traditional role. And you're seeing, you can go in the newspaper just about any day and see stories about the insurance companies harnessing their capital where they've been unprofitable for many years and starting to withdraw capacity from some of the most exposed markets. Now, one of the other tools insurance used to use to avoid these situations were incentives to reduce risk. And we've been quite effective over 300 years, really sending signals primarily through terms and conditions and price and whatnot, that if you do X, we'll give you a discount and it's really worthwhile doing. Think about the sprinklers that are in this building, probably would not be here if the insurance industry had not kind of set the standard and really enforced it. Seat belts in our homes, over and over again, you have consumer protection, health and safety standards that the insurance industry has really incentivized. The challenge with climate-related issues, heat included, is that I'm sending you a signal, an individual price signal, but the solution is at a community level. So again, there's a mismatch about the insurance sector's role in trying to incentivize risk reduction, as we tend to do, because the solutions in this case are not in your purview, are typically not in your purview. There is some you can do with your home. So we have a mismatch from a temporal alignment on the risk. We have a mismatch on the way that we are sending our risk signaling behavior incentives. So I at least, and I think at this, well, we're Chatham House rules anyway, so it doesn't matter what hat I'm wearing, right? I would argue that that is not a recipe for long-term success of the insurance sector to be able to price its way through the climate crisis. And there's a very wise CEO out there. Where's my colleague who maybe works for this gentleman or not, who has said, you know, a 3-degree future is uninsurable. And we're moving there, right? And he's also said that we're the first industry to impose a carbon tax on its clients, which essentially is this price increase you're seeing in a lot of exposed areas. So the insurance industry is right there on the front edge of trying to communicate the exposure, or trying to communicate what we do about it. Now, I'm convinced that the insurance sector will not be able to price, as I said, through it. So where do you go? What's the answer? The answer is similar to the crazy stuff we all did during COVID. Do you remember the let's bend the curve? And we wouldn't go see our mothers and our family members, and we didn't have to go to work for a couple of years, which was nice. But you remember, you'd walk around people on the sidewalk that were your neighbors. What we have to do is we need to bend the curve. That's the only way we're going to retain insurable markets out there. So I'm convinced that the superheroes, when we look back in 30 or 40 years and we see who actually, made this, whether this is Armageddon and terrible dystopia or, a survivable planet, it's going to be mayors. It's going to be county executives. It's going to be, those people, town councils, those people who somehow paid the cops to stay on the street, paid the teachers to stay in school, plowed the snow or whatever, kept the roads going, and found a way to finance mid to long-term risk reduction when it comes to climate. So these local officials are utterly and absolutely critical to the ability to bend the risk curve and keep these communities insurable. So what Lydia, Olander, myself, you, and quite a few others here with the Nicholas Institute are trying to do is to work with the state of North Carolina's Office of Recovery and Resilience and Recovery as part of a CDERS implementation, CDERS Community Disaster Resilience Zone Act effort to really engage communities and find out what kind of analytical needs do you have that perhaps the insurance industry has in some form. So we held a workshop 2-ish months ago with about 40 people who really support communities across North Carolina on some of these topics. We pushed and prodded to find out what tools do we have that they are most jealous about or that they want most and just don't have access to. And it turns out that it's really intense scenario analysis. So if I'm going to build a seawall here versus a nature-based solution there, which one is best for us? And which one will either save more lives, which one will save more people, economic value, really different scenarios, which IPCC scenario you want to kind of bet your future on. So that's what they don't have, and that's what I wouldn't say we have necessarily, but we have probably the parts and pieces to it. So what we're doing now is we've got a cohort of Duke students looking at a whole series of analytical tools that are available out there to see if we can refine those, make them accessible, and make them usable by communities that don't have a bunch of Duke PhDs working on analytical modeling for them, right? But then we've got another cohort of Duke students under something called the Bass Connections, where we'll have 8 to 10 multidisciplinary students kind of taking the tool, testing the tool with communities, seeing if we can look at innovative insurance structures, seeing if we can actually apply that to nature-based solutions. So we are literally trying to create a toolkit or toolbox of some sort that hopefully we can then match up with some of the technical assistance providers out there who could then teach the communities how to use these tools, because uninformed decision-making in this context is bad decision-making. And all we're trying to do is to help these communities really have the most modern and cutting-edge type of capability so they can make risk-informed decisions in environments where I'm damn glad I'm not a mayor, trying to make these decisions, because it's going to be really difficult. Now, where this starts to fall down as it relates to heat, and this is where I'll get less excited because I haven't figured a solution out yet. Traditional insurance is under an indemnification model. And what that means is we'll have a contract, and if something happens to you, I'm going to pay you back. And the way we can do that is through our modeling of both severity and frequency. So if we have data on both severity and frequency, we can sell you insurance, and we can do it in an affordable way through diversification and other tools. When it comes to extreme heat, to go back and say we've got the data to show you the severity and economic severity and frequency of these events, we just don't have it. I mean, it's just not credible. So you're not going to see a traditional insurance market emerge around heat until something drastically changes. Now, you're going to hear tomorrow, and I'm not going to take the thunder away from my colleagues tomorrow, but there's a new form of insurance that doesn't require all that. It's much more pinpointed, and it allows you to be much more flexible. So I think you're going to start seeing a lot of evolution on the insurance side based on the data we do have. And hopefully that data will get better. And going back to the question about communities, hopefully communities will start to learn and be given the tools to make these kind of decisions on their own.
Thank you. So, I think Francis is talking very much about, at the community scale and even a little bit at the individual, mostly communities and how they can use data, what the insurance sector role is, and helping them use this data. In the last panel, Evan, you heard conversations about measuring sort of return on investment of investing in mitigation strategies to reduce labor loss. you work very much with investors and thinking about climate risk and investors. I don't know how much they're thinking about heat. And if they're not, how can we start to get this into this conversation? How are you thinking about heat? And what kind of data they're using to better understand this? Is this something like what we heard Jason talk about? Is this something that would resonate with the investors that you're working with?
Thank you. Hi, how are you? So, oh man. The first bucket is, let me define, so these are great questions. Let me define at least how I will think about investors. I mean, there's lots of different classes of investors, right? I'm not talking about like venture capitalist class investors or whatever, but I'll drill down into how I'm thinking about, we'll start with, say, call it capital markets, but then narrow that down into what I think is the most interesting class, which is fixed income. That's a fancy term for essentially debt markets. So you're, some form of borrowing large amounts of capital for infrastructure or whatever, based on underlying collateral that's usually tied to land. So for fixed income, you could break that down into like basically 4 asset classes. I'll spend most of my time focused on, just because it's what I know best and it's US centric, the municipal debt market or ecosystem. So basically it's a $4 trillion market, in terms of the outstanding debt. That's there. The U.S. is sort of unique in that it's sliced up into like 30,000 or so different debt issuers. No other country quite has that type of granularity in like investable units. If you want to think about like a way of simplifying all this language around the municipal bond market and fixed income and all these terms that sound like more complicated than they probably need to be, think about it as like, okay, there are 30,000 different public entities and they borrow money from Wall Street on terms that are like, sort of like it's their credit card. And so there are all kinds of dynamics around what their credit is. Those dynamics are related to sort of their balance sheet health, which often, and this can be very problematic in a lot of cases, which I can get to at some point, but like that balance sheet is going to be underpinned by things like demographics and things like that. I would say about 5 to 7 years ago, there was no consideration really in this. Well, it was about 5 years ago where people really started thinking about climate risk in this space. So the way that a city or a school district or there are numerous types of issuers of debt, so borrowers of money from Wall Street institutions. The way that they primarily pay back that debt is through property value, and the actual cash flow comes through property taxes. So if you own a house, you're paying those property taxes directly. A lot of those taxes are going back to the city to then pay back, to some extent at least, what's called debt service, so AKA interest, like you would on a credit card, and then the principal is paid down at the end. So it kind of ties in with the insurance story in the sense that like property insurance is something that's either getting more expensive in a lot of cases, or you can't even get it depending on where you're at. And if you, in America is already sort of underinsured for climate risk, and that's a growing problem. And so where that's going to hit is basically the bottom line, which is property value or the liquidity in buying a home or something like that. It's not just limited to residential property, it's commercial as well, but just for the sake of keeping this simple. And so climate risk puts pressure on, potentially downward pressure on property value in some places, and then potentially opportunity if people are leaving hot places and going to cooler places in the long run, but that's another story. In terms of data, it's a little bit different than the last sort of 3 people who are up here talking about a different type of data. I think, to be blunt, I think sometimes the people talk in this particular space that I'm talking about, there's plenty of good data out there now. And what I would say is everybody's sort of looking at this stuff now and they're measuring it and they're reporting on it, but they're not necessarily acting on it or doing anything with it. We did a study, and this comes to sort of point number 2, which is like, yes, there's data, but nobody's doing anything about this yet. And this is a double-edged sword for a couple reasons. So we as a group, and there are others now, it's become a pretty competitive space, sell data primarily to Wall Street institutional investors who have portfolios of municipal bonds, and then they want to understand the climate risk. That got to be a big topic in 2018, 2019 when there was like acute stuff starting to happen. So we have a bunch of clients, and there are other people out there doing similar stuff where they're looking at things that are like wildfire and flood and hurricane and the stuff that really makes the news. And the reason for that underneath the hood is not because a manager of money who's managing a client upstream, they're not necessarily interested in it per se. They're interested in being able to answer the questions of their clients, which are disproportionately high net worth individuals who in 2018-19 started to kind of reconcile with the fact that climate is a big deal, and they started asking their money manager, like, what are you doing about climate? And so the response of the asset management community was to basically start buying data to be like, well, we're measuring it. At the same time, because of a bunch of market dynamics, like nobody's actually like not buying bonds because of climate risk yet. So everybody's looking at this stuff, everybody's thinking about it. We're at this sort of early stages, but there still is like an overall belief that like, well, you know, FEMA usually comes in and just bails these cities out anyway, so there's nothing to see here, and cities typically don't default. People are picking around the edges of those assumptions, but it hasn't changed too much. And then as far as heat, you know, for example, we give investors and people data on, you know, high granularity data on things like days above 95, things that we know have public health implications. But it needs to go to that next step, I think, and this is something that data providers need to work on, which is like translating that into things like impairment to GDP, things that investors can more clearly think about in a credit analysis and fold into like how they make a decision about like, okay, is this particular bond maybe worth less, quote unquote, than it would be because there's like a shadow price for climate that's not being incorporated. So from like a pure sort of like the climate data isn't being priced in, heat is more complicated for people to think about because it doesn't make the news per some discussion that we've seen. So like we're not there yet. But we're getting there. And then I think third, what I think is really the most interesting thing long-term here is people are in that market and elsewhere are really dramatically underestimating, this is point 3, like the long-term thing here. So like fixed income markets, like I was saying, they all depend on like real estate at some level. And the value of real estate needing to be pretty much stable and gradually increasing. But per the chat last night with Jeff, right, there's going to be a lot of the planet that becomes unlivable by 2050 because of unlivable or uninhabitable in its current form, at least. And that's going to completely upend all these assumptions about fixed income. So, you know, per your comment, the insurance market, there's uninsurable, like it becomes uninsurable at 3 degrees or even less, whatever. There's a similar problem here with everything that's real estate based and deriving from that, including U.S. cities and their debt, but probably more earlier in the process, we're going to see that internationally in like the global south and stuff. So it's a huge deal, and nobody's thinking about it. Nobody's really taking it that seriously, in the sense of like planning on a huge intervention, as far as I can tell. And this is partially because it's no one person's job, and no investor is really incentivized to think about systemic things, right? It doesn't behoove them to like swim in the opposite direction of like, look, if there's debt out there to buy in the U.S. right now, there's not enough of it, so you're going to buy it even if like it might not be a good thing long term. So changing that dynamic is complicated, and changing that dynamic, once it starts changing, it's not necessarily a good thing for climate. It's not like a purely good thing for climate risk to be priced in for investors to be doing it. I ran out of battery. The mic cut me off. I can talk loud too, though. Oh, this works. Thank you.
Have magic powers.
So, you know, that I think that's the big picture, is like all of this is headed towards some like systemic unsustainable thing, and I don't mean that in the green way, obviously. I mean that in the like it's not going to work like it works. And it's unclear whose institutional job is to figure that out. Maybe it's like the IMF and the World Bank and the UN and like the feds and central banks and all that stuff. But it just needs to get talked about more and more, is that like we're not just talking about does a city go bankrupt here and there. It's like at what point and how does like a third of America stop to function in any coherent way, and what does that mean? And it has huge implications. On a more positive note, the last thing I'll say is like I don't think it's about what, I think it's less about what data that people have or don't, because within the next couple of years, a lot of this stuff will get translated into like the insights that are necessary for what I'm talking about, but it's about whether people are going to act on it. There needs to be more creativity in terms of investment that people are doing. So I'll give you an example. So like there's a site called coolingcrisis.org. It talks about how like across the country, there's like a $40 billion need to like cool our public schools for learning. And that's an unfulfilled need. And like the data is all there. There's like the phone number of every school and how much money they need for HVAC is there. I remember we talked about this last year at Climate Week, and it's probably more like $100 billion problem if you combine it with like solar panels and HVAC and new roofs and asbestos cleanup and whatever else public schools need. But like there's a big opportunity and like a lot of capital on the sidelines, and there's no reason like an entire business couldn't get started on like one sector like that and then moved around for different challenges related to heat, but other things climate related. But institutional like main Wall Street investors right now, there's just like it's a lot of complacency and desire to keep things like
That's
they
what
are.
strikes me the most about what you're talking about is that what you just said at the top of this is there's plenty of data, right? Francis has said there's plenty of data. But people aren't changing or making decisions based on that data, and perhaps because we're not converting into proper metrics. And so, Steve, you've been very patient, and thank you. One of the things that you do with Amazon actually is leveraging data to enhance resilience and to, and thinking about how private sector corporations like Amazon can improve data availability, but maybe even help us get to this, how can we translate this into a metric, and it won't be one metric, obviously, but it will be a metric based on what will move that decision maker. What's the role of the private sector in helping us do this in companies like Amazon?
Let me just kind of put it this way. So why is Amazon here, Amazon Web Services? It's because of people. At the end of the day, Amazon and Amazon Web Services is all about the customer. The customer is all about the people that they serve, farmers and patients and insurance industry, and every one of us at some point probably is a customer directly or indirectly. And so then the job takes on a special focus. And I've taken on a path of sustainability, working with ag companies, working in the life sciences sector, and helping them drive sustainability both internally and then in the communities that they serve. So we really take on that heartbeat of our customers and really thinking every day about the patients we serve, the people impacted in the communities. When we talk about rural, how can we get connectivity out there to get the data, then to do something with it? And so that's why I'm here. It's about people. And behind every person is data. It's health data. It's climate data. There's data is the backbone of every company, of every problem that we're trying to solve. So it's great that this is a segment. Kind of excited about that. And I really don't have 37 points to make. So then the size of Amazon Web Services, and then take all the customers who run their businesses on Amazon, we have a responsibility to serve the communities and to use that data and technology to reach the people. So when you ask how does a private company like Amazon and others, how do we come together? It's through things like what we're doing here. It's we work with NOAA in the group to make their data available on Amazon so that others can come in and do research and discern that data and get it to where it's needed to drive policy, to make decisions. And so we provide a backbone for data. We protect the data. We provide new technologies that are changing so quickly to draw new insights, to gauge whether that data does make sense. and should it be used, and how can it be used, and how do we take all these different types of data in the world and bring them together and draw inferences that we could never see. When I'll bring back COVID into the picture. We moved really quickly as a nation, as a world, to come up with pathways to help people, and it was by leveraging new innovations, new technologies to get drugs to market quicker. And we can do that with heat as well. And we can't do it as one company doing it all. We can't do it by three. It has to be everybody. So it's, at the end of the day, really the theme of HeatWise is people, because people and their pets and livestock and the biodiversity, everybody is impacted by heat, getting that data. So we do some of the things that we can do. Ag is already at the forefront of having to solve getting connectivity in rural areas. The farmers need that data to be able to both address climate and to get the most yield out of their seed, so that we can get the food out to to meet where people are. The ag sector is at the forefront also of meeting the unmet needs in areas that are unserved. And so there's a lot we can learn from that sector. The health sector, certainly bringing data together, both for patients and for research, both protecting data, but then making data available so that we can discern and we can learn from it. That's huge. I was watching Shark Tank last night to go to bed. They had a thing where a guy was coming up with a solution to get DNA, let people provide DNA samples through saliva so that they could get more and more data to provide to researchers when they need it. Data is key, but it's coming together and learning. So to kind of make this a little bit crisp, one of the things that we can do, to be on the solution side, not on, because we know the problem is real, is bringing the ag sector and bringing the health sector and then bringing the public sector together to bridge the gaps of data. Imagine if EPIC worked with the government, the different agencies represented in this room, to share health data and correlate that data with heat, with temperature. That's amazing. I had an example pop up, and this was actually a long time ago. I won't give the year because then I date myself, but I was working in a cell phone factory, and at a certain time in the afternoon, we would start seeing failures in the factory, and we could not figure out why, because every other time it worked. I don't know what made me go down this path. Maybe it was foreshadowing that I would be here one day, but I went out and looked at climate data. And I noticed at the time of the failures, the humidity was at a certain point, static electricity was at a certain point, and that's why we were having failures that nobody could figure out. But climate impacts us all in ways that we can't see unless we bring that data together. That who would think an operator put in a phone and a test harness in a factory, that there's a relationship with what they're doing and the weather outside.
Yeah,
We don't see the connections.
I
until
think
we
there's no
bridge the
doubt
gap.
that there are connections happening that we haven't yet made. It's not lost on me that the differences between that first panel and this one, we had people that were, for the large part, working in local community organizations, local governments, federal governments, and particularly at the state, local, community level, talking about barriers with data and data they need. And then, of course, all of you on this panel, talking about the data that you need is that you have. And so I think your idea there about the need to foster collaboration between the private sector and the public sector is a critical one. We raised the issue of universities as one kind of way to facilitate this, particularly around health data. But, is this just is this a Pollyanna idea? What can we actually do to make this happen? I feel like people have been talking about, the need to help collaborate, to foster collaboration between the public sector and the private sector on this data issue for a really long time. And I just don't see that it's moving forward.
Yeah, and I think it's working together. And we have an example coming up, even with Duke and with Ashley. I leave from here to go to Sweden to meet with a pharmaceutical to address sustainability, and where they care about is the impact of climate on health. Well, when I told them what I'm doing in the days before I hop on that plane, they really wanted to jump in and try to attend, virtually or in person. It didn't work, but they didn't know because they didn't know. If the more that we can get out the word that groups like this are meeting and they're coming together to solve the world's toughest and most impactful challenges, until people know, they don't know. And so because of that communication, now I think we're going to try to bring the pharmaceutical into the picture, where we can take the data from and the good work Duke is doing, this institute, and merge that in the pharmaceutical space.
Any lawyers in the room? There's nothing that scares a lawyer like privacy exchange, exchanging confidential information.
But is it really all the lawyer's fault?
It's not the lawyer's fault. In this case, it normally is, but not in this case. So there's going to have to be, some type of government involvement, to kind of give it this imprimatur of legitimacy and credibility. So it really is going to come down to truly a public-private partnership where everyone understands their role, everyone brings their capabilities there. We do it in a way that respects individual privacy, but draws the insights out of those that could be done. So it's complicated when you want to start sharing information. I mean, take it from an industry that is based on, hundreds of years of information. We still have challenges with sharing information, even anonymized. So that's going to be a challenge, but it's not insurmountable at all. I think you have a law school here that might be able to figure that one out.
I mean, Evan, is this a pipe dream? Like in your space, what do you see?
That's a good question. I was thinking about it. We've had several, we've made sort of several, I don't want to say that they're it's pipe dream it's definitely not a pipe dream. It's an incentives problem I've seen, and then a misalignment problem in my particular world where it's okay, you would think there was something here because one of the chief complaints you get from investors is well, we don't have enough disclosure about climate risk or whatever. Then there's the issue of well, why is that the case? Well, there's lots of reasons, but one is bond counsel is why would you, they don't want you to change anything, don't disclose any, don't make it harder on yourself, don't disclose risk. On the flip side, it's well, why would we expect 30,000 debt issuers in the U.S. or small communities aren't going to all be able to model and understand and deal with their own risk? And so you would think that and I still think there is somewhere here, there's a relatively simple opportunity to say, well, this is why third parties exist to help with this, and then you could challenge our data. And we, speaking for at least myself and some of my colleagues at ICE, we love to just give our data out to cities and stuff. We can make money selling it to institutional investors, but giving it out to cities would be great. But we just haven't seen that strong of a demand for this kind of thing. There's at least a couple reasons for that. One is there's lots of issuers that just don't have time for this. They're very, very busy. And the other is that well, if I'm reflecting back to the kind of data that Jane needed in terms of well, is it 30 or is it 600? That's just not aligned with the type of data that groups like ours are necessarily generating because it's not as directly meaningful to investors. So there's sort of this dance that's been going on for years about well, we needed to collaborate and give issuers data, but then there's just no take up on it. So I don't have a great answer.
Well, I think
you don't.
Yeah. Well, I think
I want to disagree with my friend here, and yes, you do need oversight. Yes, you do need attorneys and looking at all this and being the protectors of that data, making sure that personal information is not being disclosed. But we do see it working, and you see more and more of it in the health industry, both on the patient side and on the research side. So, a lot of the problems that we're trying to solve, even though we don't have all the answers very clear, we have a lot of good examples and the pieces that we can begin to put together. And then through all the talents and all the different types of things we bring to the literal table in this room, we can solve problems that are so much bigger than any of us. Right?
I'm going to take Steve's hopeful approach and say that, it's definitely clear that one of the challenges is getting the right data accessible, available in the way that is relevant to the people who need it is obviously one of our biggest challenges. There are some challenges with data collection for sure, especially for things like heat. But for the most part, I think there are avenues to get either the data or proxies for the data that we need that are available. And so I hope that in the roundtable discussions, what we really start to come up with is, how can we actually start to bridge, to move a path forward to facilitate this idea, right, of how we can foster this collaboration that's needed and start to kind of bridge these data gaps. Because, in 10 years, I feel like for years we've been having the same conversation at the community level. I mean, 10 years ago, I was working with emergency management, trying to help them just understand the impact of climate at the county level in their community, and it was really difficult to do. Now, some things have made that a little bit easier in the last 10 years, but honestly, I feel like we're almost where we were. So I hope that we can start to really move forward on this. It just seems like we sit and spin on this topic a lot. So with that cheery thought, we are out of time, and so I want to thank all of you for talking about this complicated issue with us. So quick round of applause for these panelists.